Urinary incontinence can happen to anyone, but it's more common with age. In fact, about 1 in 3 elderly people have a problem with bladder control, with women affected twice as often as men. TGMC provides valuable information on the causes and treatment for urinary incontinence.
All right, welcome back. Let's introduce our guest, Dr. Rob Alexander. On the left, a urologist, and Blair Duthu, TGMC's physical therapist. Welcome to the program, gang. We appreciate you being here.
Thank you.
All right, Blair, first question. Urinary incontinence. First of all, explain it to us and tell us what it's all about.
Okay, there are a couple different kinds of urinary incontinence. You can have stress incontinence or urge incontinence or a mixture of both. Stress incontinence, women, a lot of times when they sneeze, they may have a leakage of urine. You feel the need to kind of cross your legs when you sneeze, things like that. That can be caused by weakness in the pelvic floor. The urge incontinence, on the other hand, is more what you call the key in the door syndrome. So a lot of women, the moment you walk in the door, put the key in the door, you have to run to the bathroom. It's an urgency. Or you can have a mixture of both. A lot of times, older in age, women will experience more problems with incontinence. And it's very socially unacceptable because, you have to have a bathroom close by.
Probably just a scary situation to be in. You got to get them past that, don't you?
Definitely.
So, Dr. Alexander, the symptoms of this, what are the symptoms?
Well, it's interesting. When people come in to see me, females I'm talking mainly about, because there's about 2 to 1, like they say, instance of females to males. They just come in and they'll just say, I'm leaking. And what you have to do during that conversation is kind of make the distinction of what's causing their leaking, where's it coming from. Because people just don't have that distinction. They just say, I'm leaking. Fix it. And they almost every time it's a person that's been having the trouble for quite a long time, anywhere from a few years to maybe even 10 years, and they've been so scared to come to the doctor that they've waited that long to come. And of course, the first thing you do is you take a real careful history and you start trying to make differences like, do you have to hurry to the bathroom like the key in the door syndrome, or do you have when you cough or sneeze? And then when you get to that point, then you start narrowing down exactly when that happens and all these type of things. Then you go to a physical exam, because then you can see physically what's wrong, whether they have the pelvic floor relaxation, whether they have other problems like urethral stenosis, infections, all these type of things. And then you start making recommendations, and they're usually very afraid that it's going to be surgery every time that's going to be the solution. And often it's not. Often you can do it with either Kegel's exercises to help people, or you can give them medication. But if they have a severe enough stress incontinence, meaning leaking with coughing, straining, and that type of thing, then usually there is a surgical solution for that.
So you find they wait a lot, they wait a long time? They just don't want to go right off the bat.
Well, they're scared to death. They're afraid that, they're not going to be able to get it corrected, and they're afraid it's going to be painful and it's going to be, uncomfortable.
Probably a normal reaction.
Absolutely.
But you could get them through.
Yeah, by the end of the day, we're exhausted because people don't like to come see us. And we have a complex by the end of the day.
And they should go see you, for sure. Right. Blair, the healthy urinary practices, what would they be?
A lot of women, mostly I say women, but people tend to not drink enough water during the day by fear of needing to go to the bathroom. Healthy practice, you should drink a half an ounce of water per pound of body weight, which many of us don't get because you feel like you need to be in the bathroom all the time.
I'd be drinking a heck of a lot. Okay. That's a half of what?
Half an ounce of water per pound of body weight.
Okay. All right.
And by doing that, you should be able to last 3 to 4 hours before needing a bathroom. And we develop habits, even as a child. You take your kids out of the door, you tell them you better go to the bathroom just in case, because once I'm on the road, I'm not stopping. So we develop those habits where we're emptying our bladder before it's full. And then as you get older, that gets worse, and every half hour you're needing a bathroom.
That's a good point. So the more you get into those situations, you're learning something different. Your body's learning something different.
Right. Rather than letting your bladder fill up to its maximal capacity and then voiding.
Okay.
Many patients that I see as part of physical therapy, not necessarily urinary patients, just in general, I'll ask them the first question, how often do you go to the bathroom at night? 3, 4, 5 times. That's an hour of sleep every time you make a trip to the bathroom.
Right.
you're not resting, you're not going to feel well during the day. So
yeah, it's just not good. So, Dr. Alexander, what can cause urinary incontinence? Can you give us some examples?
There's such thing called an overactive bladder, which is kind of a catch-all phrase for people that just have irritable bladders, and that can come from various causes. In females, it just can come from old age, when you get old like me. In males, it can come from BPH symptoms, like obstructing prostate symptoms. They can get overactive bladder. The stress incontinence, usually in females, comes from either having children before or some situation where they've lost support of their floor of their bladder. And that can be fairly easily corrected these days. In the olden days, you went through a major surgery that you had to have a catheter in your bladder, sometimes for up to 8 weeks. Now you can have an overnight stay, sometimes go home the same day, just have a catheter overnight with about a 90% success. 90% sounds good, and it is good, but being a perfectionist is not good enough for me. I mean, the 10% that don't do well, I'm always suffering over that, as my wife will know. And so it's a fairly correctable problem. It's fairly easily correctable. It's not an easy surgery to do, I don't think, because it's so precise, but it's a very successful surgery.
But that's what makes you a great doctor, that 10% that you want to get better.
That's it.
We'll take a break. We'll hear from Terrebonne General Medical Center. When we come back, more questions. The bladder matters. Don't go away.
Think of 6 men you know. One of them will get prostate cancer. Early detection can save a life. Make an appointment with the experts. Mary Bird Perkins Cancer Center at TGMC.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
All right, welcome back. We're going to ask Dr. Rob Alexander our next question. How can a doctor or a physical therapist help in all of this matter?
Right. Well, I think the first thing the doctor can do is to take the careful history so that he gets the right distinctions on what type of incontinence they have. It's very important to do a physical exam on the person, whether it's a male or female. If they have an obstructive problem, and you can correct that, a lot of times you can correct a lot of these urgent incontinence symptoms. If they have a problem that's in a male, obstruction from a prostate, you can do certain surgeries to correct that, because they can have overflow incontinence, meaning they can't empty and they just overflow. Or they can have urgent incontinence for the same reasons women do, because they're straining hard to get to the bathroom and it makes their bladder overactive. A woman can have things like interstitial cystitis, which is a condition of the bladder wall that makes them have urgent incontinence. They can have a condition called urethral stenosis, means the urethra is too small and it's got inflammatory polyps, and you can treat that and they do better. And if they have the fallen bladder or loss of support, you can put what's called a sling that'll support the urethra and correct the problem. And you can do a very simple test in the office called a Bonney test, where you have the person in lithotomy position, which means they're in stirrups, and they put some water in their bladder, have them cough and strain, and see if they leak. And then if they do leak, you can get some port to the urethra and see if it corrects it, and see if the surgery is going to correct it right then. So with a very simple test in the office, you can tell with a high degree of certainty if you can help the person or not.
There's a lot. I mean, it's not just one thing, which I thought was a lot of things.
It's a lot of things.
But the treatments, what are some of the treatment options?
Well, the treatment options are, for if they have an overactive bladder, which is very common, there are about 6 or 7 medicines on the market to treat that. Now, the hardest thing is trying to pick the medicine that you think is the best. I mean, there are so many out there. you obviously have one or two favorites that you like, but all of them work similarly. Okay. And so you usually put people with overactive bladder on these medications. You'll often try to have them, if they have urinary stress incontinence and it's not too severe. Interestingly, weight loss helps incontinence in females. They did a study that they showed that if a woman lost even 10 to 15 pounds of their body weight, that they'd have over a 50% reduction in their incontinence, just with 10 to 15 pound weight loss, which is quite remarkable. And then, of course, they can do the Kegels exercises that Blair can teach people to do very accurately, which is not that easy to learn to do. Right. And that can help minor degrees of incontinence. So that's kind of a general overview of what you can do to help most of these matters.
Okay. Now, Blair, the pelvic floor, how important is that?
It's extremely important, and that's crucial in order to prevent the incontinence. A lot of people don't realize what the pelvic floor does or how to even contract the pelvic floor. So a lot of what I do is patient education. I do a physical exam as well to see the strength of their pelvic floor. A lot of it is education. Let gravity assist you while you do the Kegels for those that have the prolapse of the bladder or the rectum. Those conservative measures, and even post-surgery, if they do have a procedure with the urologist, physical therapy is definitely a key afterwards so they don't damage the correction that has been done. So a lot of it's education. And I use biofeedback. And it's a sensor that we place on the pelvic floor, and it lets the patient know what the pelvic floor is doing, if it's contracting or if it's relaxing. Because a lot of times people want to hold their breath and contract their abdominals thinking they're doing a Kegel, but actually they're doing the opposite.
Oh, okay.
So
no cheating for sure.
No cheating for me.
Well, the way she comes out very, very, very valuable is there's a condition called detrusor dyssynergia, which is sounds very complicated, but what it really means is when the bladder contracts, the urethral muscle that holds the urine is supposed to relax. Okay. And when I first started training urology 40 years ago, that wasn't even known that that was an issue. Now we know it's a very common issue. And the reason it occurs is when these women have leaking problems, they're intuitively strengthening that muscle or tightening that muscle to hold their urine in. And sometimes they tighten it so much they can't relax it to urinate and they don't empty well. Okay. And you actually have to have Blair and them teach them how to relax those muscles, and we will sometimes give them medications to relax those muscles to have them just empty properly. And
it's almost like retraining.
Retraining your bladder. And it's more common than you think. You'd think it was kind of an obscure diagnosis, but it's a very common diagnosis. I see it almost every day.
Okay. What about the rehab programs at Terrebonne General Medical Center in Old Blair? What do they have to
I'm in outpatient rehab, so primarily you need a referral from your physician, and I'll do my full exam on the patient and kind of determine along with the doctor, what the problems are. I do a physical exam only if the patient is open to it. I think a lot of people are apprehensive about coming in to see me because they think, oh gosh, they have to do another physical exam, and it's not acceptable. I only do that if the patient is comfortable, but a lot of it is education, even as far as lifting things off the ground, how to let your pelvic floor help you when you do that, rather than doing things to harm your body.
I want to thank y'all both for coming, but Dr. Rob, you get the last question. Your golf game. Everybody wants to know how your golf game is going.
Terrible.
I'm sure it's doing pretty good.
No, it does okay. We just got back from a little trip from Colorado with Dr. Dickey and Jerry Schwab, and it was wonderful. We had a wonderful time.
God bless you on that. You had to put up with those guys all those days?
For 4 days. It was a blessing. Well, two nicest people you ever meet.
Yeah, and you are too. And thank y'all so much for coming. We appreciate y'all being on tonight. We are going to take a break. When we come back, Nicholls State University takes over the set, and they'll have a lot of news from the university, so don't go away. We'll be right back.